If you have deep hip pain, deep groin pain, and sensation, abnormal sensation into the inner thigh area, you may have issues with obturator nerve, and nerve flossing is the right thing for you more than likely. So if that's your story, stay tuned for more videos and more instruction. Hey, this is Dr. Shakib from Irvine Spine and Wellness Center, your Irvine Chiropractic Posture and Movement Clinic. Like I said, if you have deep groin pain or deep hip pain, more than likely your obturator nerve and your obturator muscles are in need of some attention. I've done a video on what nerve flossing is. Let's just briefly say that when a nerve is being compressed or overstretched, it doesn't like it. So every nerve has a sheathing, and nerve flossing will allow the proper movement of the nerve within its own flossing, so there's no adhesions and stickiness, so to speak. So with obturator nerve, it comes from the lower back area and it goes to the obturator muscle, and then it goes to the inner thigh area. So what you want to do is, with the flossing, we want to stretch one end while we keep the other end the same, and then we want to stretch the other end, and ultimately we want to stretch from both ends, which is the most challenge. You do not do these things right after another, meaning on the same day. What you want to do is you want to ease your way into it. So in this case, what we're going to do is we're going to keep our head nice and straight and simply bring, let's say if it's on this side, bring the leg out into the abduction, ABD, going away, and then we bring it down. So you can start with that. Then you go, as you go out, you bring your head up like that. And then the more advanced one is when you bring the leg out and you look down. So you're stretching from both ends. And in the process of doing that, you see which one actually helps you more. If you have an obturator nerve that needs to be flossed, you will notice an improvement in your symptoms. And of course, just because you flossed it doesn't mean that your problem is going to go away. Now what you need to do is you need to look at the functional mobility of your hip joint and look at the torso or your trunk stabilization in the process. Because at the end of the day, you want to see, well, what made my nerve not work well to begin with? And that's always the good question to ask. What happened? Unless someone hit you hard in that area causing a problem, if it came as a result of, let's say, a sport that you're playing, well then what is it that in your playing mechanics that is feeding this problem? That needs to be looked at. It's much easier to solve a problem before it becomes huge. If you have had this symptom and these problems and you still have not really resolved it and you need some help, make sure you use one of the methods of contact on the description box. And if you're not following us on Instagram, give us a look. The handle is Irvine Spine. Thanks for watching. Take care.